morning. It's great to see so many people here this morning. We've got a very exciting session this morning with three terrific speakers coming up. And what I'd like to do is just set the stage for our discussion this morning and tell you a little bit around the work that we've done over the last year to crystallize our view and our strategy going forward over the next several years. And the tagline that we have around that is "In It Together." So just to put this in stage, UHN is currently Canada's largest research hospital. And we have a commitment to research that spans a very large scope in terms of the burden of disease that Canadians and individuals around the world face. We consist of 4 hospital sites, as you know: Toronto General, Princess Margaret, Toronto Western, and here at Toronto Rehab. We have 10 medical programs. We have 6 dedicated research institutes across UHN. We have our own education institute, and we have, of course, 3 amazing foundations that help drive and fuel our ambition. And together, our scientists and clinicians and researchers work on chronic disorders and other areas of research that constitute approximately 70% of the global burden of disease around the world. And we've been very proud of our position as Canada's top research hospital over the last 7 or 8 years. And just to give you a bit of indication of what that looks like, we also are Canada's patent leader. And here at Toronto Rehab, and the innovation has always been a very big part of what Toronto Rehab and Toronto Rehab Institute is aiming to do, is to bring that basic discovery back to patients through innovation and through commercialization. Our research plan was developed over the past year with the input of almost 300 individuals. We had patient partners, we had scientists and clinicians, we had all of our research institutes and clinical programs together. And our strategic plan ultimately is based around the needs of our patient. And if we take a look just in the area of dementia, the focus this morning on Alzheimer's and the burden of disease that this represents, this is a graphic indication of the annual number of deaths by cause here in Canada. You see the big ones at the top: cancer, cardiovascular disease, and dementia in third, accounting for about 20,000 deaths of Canadians each year and around 2.4 million worldwide. And these are very interrelated, because as we develop better therapies for individuals, as people live longer lives, as we make progress in cancer and cardiovascular disease and diabetes and others, patients live longer. And the burden of disease around areas of dementia, Alzheimer's disease, and other neurodegenerative diseases becomes increasingly larger. And this is reflected here. This is the number of dementia-related deaths since 1990 has increased 150%, from 1 million around the world to nearly 2.5 million. And this is driven primarily by our aging population. You see the breakdown in age distribution there. The vast majority of those individuals are those that are over 70 years old. And the reality is that we have very few effective disease-modifying therapies for these patients. And our ability to make progress and change the lives of these individuals is premised on our investments that we make today in research. And we're very proud of the investments that we're making across UHN, and particularly here at the Toronto Rehab Institute. So our mission at UHN Research, as we've defined it, is that together we drive excellence in discovery and innovation to create a healthier world. At UHN just completed its strategic plan, and its vision is a healthier world. And we propose that our path towards that healthier world is through a commitment to research and innovation and translation back to patients. And we have 3 big goals at UHN to create research impact. We have a commitment to understanding the fundamental elements of health and disease. So we're a series of hospitals and a hospital-based research institute, but we make significant investments in fundamental areas of biology and in disease. We have scientists here that work in very basic areas in molecular biology and genetics, in the fundamental aspects of the brain and signaling. And we do that because of the unmet needs of our patients. There's still gaps in our knowledge. There's a lack of understanding that creates a barrier to progress and future improved therapies for patients. And so we make those investments here. And we make those investments here in part because bringing that fundamental science and discovery science into this environment where we have patients coming through our doors every day with clear unmet needs and opportunities to change. We have amazing clinicians and scientists here treating those patients, wanting to work together as part of those teams to bring the problem to the scientists and bring the solutions back to the patients. And so the second big area that we commit to is the acceleration of our discovery and translation back to clinical practice. We want to increase the rate at which we do this, where we take discovery and move it back quickly into the clinic to affect patients. And then finally, our third big goal for research impact is training and developing tomorrow's research leaders. We have almost 1,000 research trainees across UHN, spread across our research institutes and our hospitals. And these trainees ultimately are the leaders of tomorrow. They will be doing the research, they will be treating our patients, and they will be training the next generation after them. And it's a huge part and a huge impact of what we do here every day. And we've also defined what our goals for organizational excellence are. These are the areas that we want to measure ourselves against others and against our progress as we move forward. And we commit that our research institutes are going to be recognized amongst the world's best. We don't want to be the best in Toronto or the best in Ontario or the best in Canada. We want to be the best in the world. And Toronto Rehab Institute is the best rehab institute in the world. We also want to have a diverse and collaborative and empowering environment. I talked about this opportunity for synergy. What does it mean to come and want to work at a place like UHN? It gives you the opportunity to work not only with like-minded colleagues, but also with clinicians, with individuals at other research institutes, and the opportunity to collaborate, not just across discipline, but even across disease and across a variety of research and areas of expertise. We believe that this is what attracts talent, this is what retains talent, and this is what makes the best want to come and work here and be in Toronto. We also want UHN and our hospitals to be the best place for patients to go and to benefit from this leading edge research. We want us to be a terrific partner, not just internally across UHN, but in our environment here in Toronto, and increasingly a global hub for research and innovation, for our healthcare partners, for our philanthropic partners, and for leaders across industry, science, and technology. And then finally, our fifth area is we want UHN to be a strong and financially sustainable organization. And to do so, we want to ensure that we're achieving the highest possible impact with all of the resources that we have at our disposal, whether they come from industry, whether they come from philanthropy, or whether they come from government. And so we've outlined 5 strategic areas, and we're going to be making and creating a series of new initiatives that will take place and launch this fall in each of these areas. The first of these is to engage every patient that comes into our system. We have a goal to have every single patient who comes to UHN to be a partner in research and to have the opportunity to participate in and benefit from research. We're going to launch initiatives to further empower our research teams in collaborations from basic science to clinical and health policy research, but also collaborations across UHN. We're going to launch initiatives to accelerate the translation of discovery to practice, launching new efforts around clinical trials across UHN and new areas in commercialization. Like UHN, we're also investing in the power of technology and innovation. You've seen, and we'll have an opportunity to see today, some of the amazing technology that exists here at Toronto Rehab Institute. It's been built over the last 5 to 10 years that empowers our scientists. And then finally, we're also going to continue to grow our research through financially sustainable structures. And I think one of the best examples of this that touches on many of those points is the initiative launched last year by Tawfiq, we just saw came in, and Milos, who you'll hear from today. These are represent this opportunity that we have at UHN to collaborate across discipline, to collaborate across disease. These two came together and have launched this new initiative that we call CRANIA. And this is, in the spirit of collaboration, brings the university together, it brings our research institutes together, it brings our hospitals together. It's been funded by a major investment by the Canadian government, and also, of course, a major support from philanthropy. This was launched last year. We're really excited about what this can do. It sits at this opportunity to accelerate translation back into the patient. You're going to hear from Milos, I think, around some of the excitement around this. But it's a bit of a poster child for what we want to create in many areas across UHN. And finally, I want to also personally acknowledge our thanks to Walter and Maria Schroeder, who made CRANIA possible through their transformational gift last year. And to all the donors, like Walter and Maria Schroeder, who recognize the fact that our funding from governments can make us good, but it's philanthropy that can make us great. And we are very grateful for that trust that you have in us to steward those funds. And we take it as an exceptional opportunity to change our output in research and to change what we can do for patients.